Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Imagine this. You wake up, throat feels a bit scratchy. You know that feeling.
Oh, yeah. Happens all the time.
You probably think, just a cold, maybe grab some tea, right? But what if that little tickle was actually the start of something much more serious, even deadly?
Scary thought.
We're talking about Streptococcus pyogenes here. You probably know it as Strep A. Now, for lots of people, it is just a mild thing, a sore throat, maybe a skin infection.
But that's not the whole story, is it?
Not at all. Globally, this thing is, well, kind of an invisible threat. It takes up to 500,000 lives every single year.
500,000. That's staggering. And it hits low and middle-income countries the hardest. Repeated infections, they can silently damage the heart over time.
Leading to rheumatic heart disease.
Exactly. It's this silent killer claiming hundreds of thousands of lives, mostly young people. It's a huge global health issue that just doesn't get enough attention.
And it's not like it's only a problem over there. We saw that big outbreak in the UK and Europe back in late 2022, right?
Yeah, that was serious. Hundreds of deaths, tragically including many children, even in countries with advanced healthcare.
So despite all this, despite the death toll, there's been this massive medical puzzle. No widely available vaccine. Why has it been so hard?
Well, historically, the biggest hurdle, scientifically speaking, has been understanding how we actually fight it off naturally. How does our own immunity develop against Strep A?
Right.
Without knowing the body's protective game plan, designing a vaccine that works reliably has been incredibly challenging. Like Dr. Alex Keeley, who led this new research, said, we just haven't had that fundamental understanding.
Okay, so that brings us to today's deep dive, because there's some really groundbreaking research out now that might finally crack this code.
Yes, exactly. It's a pivotal study published in Nature Medicine, comes from the University of Sheffield, working with the MRC unit, the Gambia, at the London School of Hygiene and Tropical Medicine.
And what they've done is uncover how some children actually develop this natural immunity. It feels like a massive breakthrough, maybe the key to finally getting that life-saving vaccine.
It really could be.
So our mission today is to unpack this research. We want to understand what it tells us about preventing Strep A and, ultimately protecting people worldwide, especially the most vulnerable.
Let's get into it.
Okay, so we know Strep A is a huge problem. Vaccine development stalled because we didn't get the natural immunity part.
Mm-hmm.
This new study is aimed right at that knowledge gap. How did they actually go about studying this? What was their approach?
Well, they took a really unique and, frankly, quite ambitious approach.
Yeah.
They didn't just want a snapshot. They wanted to see immunity developing, in real time.
Right.
So they went to the Gambia, where Strep A is unfortunately very common, and they tracked children over long periods. They looked at antibody levels right from birth and then followed them through childhood.
Wow, from birth.
Yeah, they recruited over 440 people from 44 different households, followed them monthly, and they even had this special group, 94 mother-child pairs, to really zoom in on that critical first year of life.
So they weren't just looking at sick kids, but everyone in the household.
Exactly. Capturing infections, but also just carrying the bacteria without symptoms and how the immune system responded over time. It gives us this incredibly rich long-term picture of how immunity builds up.
That sounds like an immense amount of work, a really valuable data set. So after all that tracking, what were the big takeaways? What did they learn about how natural immunity actually works?
Okay, so one of the absolute key findings, maybe the most crucial one, is identifying what they call a critical early life window for developing immunity.
An early life window, what does that mean?
Well, we know babies are born with some antibodies from their mothers, right?
Mm-hmm.
Gives them a bit of protection early on.
Mm-hmm.
But that protection fades pretty quickly. And what the study found, crucially, is that young children, especially those under 2 years old, then start mounting their own really strong antibody responses after they get exposed to Strep A.
Under 2, that young?
Yes, really vigorous antibody increases in that age group. And it didn't matter how they were exposed. It could be a sore throat, a skin infection, or even just carrying the bacteria without showing any symptoms. Their immune systems were reacting strongly.
So the body's prime time for learning how to fight Strep A is in those first couple of years.
That's what it looks like. It's a fundamental insight.
Right.
It basically tells us when our bodies are most receptive to building this immunity, which, has huge implications for vaccination timing.
Absolutely. That gives vaccine developers a potential target window.
Okay, so Besides when this happens, did they figure out what specific parts of the immune response were actually doing the protecting, like which antibodies? Yes, and this is another really exciting part. For the first time, really, in humans, they managed to link specific types of antibodies directly to protection against future Strep A infections.
Okay.
They focused on antibodies against what they call conserved vaccine antigens. Think of these as parts of the Strep A bacterium that are pretty much the same across lots of different strains, universal targets almost.
Ah, so not specific to just one type of Strep A.
Exactly. And they found that having higher levels of antibodies against these conserved bits, things like the bacteria's hemolysin, which helps it break down red blood cells, often called SLO,
Okay.
and an adhesion protein that helps it stick to our cells, called SpA-D, and a protease enzyme it uses, SpA-CP. Higher levels of antibodies against these were strongly linked with being protected from getting infected again later.
That's huge. Because if you can target something common to most strains,
Then a single vaccine could potentially offer broad protection, right, against many different Strep A types circulating globally. That's a major goal for vaccine developers.
makes total sense. But hang on, just having the antibodies isn't always enough, is it? They need to actually work. Did the study show these antibodies were functional?
Great question. And yes, they did. This wasn't just about counting antibodies. It was about showing they could, do something useful.
Right.
They found that higher levels of these protective antibodies correlated strongly with what they call functional activity. So these antibodies could actually stop the bacteria from doing harmful things, like breaking down those red blood cells I mentioned.
Okay.
And they could also help the immune system clear the bacteria out, promoting a process called opsonophagocytosis, which is basically flagging the bacteria so immune cells can eat them.
So more antibodies meant more bacteria fighting power.
Precisely. Linking the level of specific antibodies to their actual function and stopping the bacteria, that's really powerful evidence. It validates that these are likely the right targets.
Okay, so let's pull this together. We have this critical early window for immunity. We've identified specific conserved targets, and we know the antibodies against them are functional. What does this actually mean for those 500,000 lives lost each year? This sounds like it could be a massive step forward.
It really is. I mean, you can't overstate the potential significance. Dr. Keeley put it very clearly. Our findings represent a significant step towards a safe and effective vaccine that could potentially save hundreds of thousands of lives.
Wow.
This study directly tackles that historical barrier, the lack of understanding about natural immunity. It gives us concrete human evidence of how protection works.
It almost sounds like they've written the instruction manual for a Strep A vaccine. Here's what to target. Here's proof it works naturally.
That's a good way to put it. And Dr. Keeley pointed this out too, saying, now for the first time in humans, we've been able to observe how antibodies that would be made following vaccination may be preventing infections.
Yeah.
And show how they might work.
That basic understanding was the missing piece.
It really was. And the fantastic news is those conserved targets, they identified the hemolysin, SLO, the adhesion protein, SpA-D, the through-clay-C, SpA-CP, they are already included in several vaccine candidates that are currently being developed.
Well, that's brilliant. So this research directly supports and validates the work already happening.
Exactly. It gives those efforts a huge boost of confidence.
And what about the timing? Does this change how we think about when to vaccinate based on that early life window finding?
Absolutely. That finding is really key. The fact that the strongest immune responses happen in kids under 2C suggests, as the researchers state, that future vaccine trials and modeling should evaluate the impact of vaccinating children under the age of 2 years.
So vaccinating really early could be crucial.
It could be critical, especially for preventing those long-term severe complications like rheumatic heart disease, which often starts with infections in childhood in places where Strep A is common. There's a quote from Fatoumata Camara, one of the Gambian scientists on the study team, that really brings home the local importance. She said, "In the Gambia, Strep A carries a devastating burden. A vaccine offers hope as a powerful tool, enabling children and young people to thrive."
That really puts a human face on it. It's about giving kids a chance to avoid these devastating outcomes. Okay, this is clearly a landmark study, a huge leap. But, in any deep dive, there are always nuances, complexities. Did the researchers themselves point out any limitations to this particular study?
Yes, and that's always a sign of good science, acknowledging what you couldn't capture perfectly. They were quite transparent about a few things.
Like what?
Well, for instance, with those mother-child pairs they followed in the first year, while they saw antibody levels go up, they couldn't always definitively link every single increase to a brand new confirmed Strep A exposure event in the infant.
Ah, so they saw the immune system react, but sometimes the trigger wasn't perfectly clear.
Kind of. They also noted that their detection methods, mainly bacterial culture, might have missed some Strep A infections or instances of just carrying the bacteria. Culture isn't as sensitive as some newer molecular methods.
Right.
And Strep A carriage can be really brief. The study mentioned a median of only about 4 days, so sampling once a month might have just missed some shorter events.
Makes sense. Anything else?
They also mentioned that statistically, they didn't have enough power in their analysis to set separate protective antibody level thresholds for throat infections versus skin infections. So more work needed there. And they acknowledged some technical limitations with some of the assays used for another type of antibody, the M protein antibodies, affecting specificity.
Okay, so while the main findings about the conserved antigens and the early window seem really robust, they're upfront that there are still details to nail down and refine.
Exactly. It's about being precise and acknowledging where the next research questions lie. That self-awareness is vital.
Absolutely, it drives the science forward. Well, this deep dive into Strep A immunity has been incredibly illuminating. It's genuinely inspiring to see how digging into our body's own natural defenses can provide the keys to tackling these huge global health challenges.
It really is. And this study gives real, tangible optimism. It supports approaches using those conserved antigens we talked about, but also potentially other vaccine types too. It highlights how science moves forward, building on what we know, acknowledging what we don't, and pushing those boundaries.
Thinking about all this, the research really emphasizes how quickly immunity can develop in very young children. And even in their study, a small number of kids already had protective levels early on. So here's something to ponder. Beyond just developing a vaccine, how might this deeper understanding of natural early life immunity influence broader public health strategies? Could it help us protect children even earlier, maybe reshaping how we approach childhood immunizations overall?
That's a really interesting question to think about. It definitely shifts the focus to that very early period. And, the researchers themselves stress the next steps. The urgent need for more well-designed studies, especially clinical vaccine trials, in places like the Gambia, where Strep A hits hardest.
To really confirm these findings and nail down exactly what level of antibodies equals protection, the so-called correlates of protection.
Precisely. That's the crucial next hurdle, to clear on the path to finally getting an effective Strep A vaccine out there to the people who need it most. It's a global effort, and this study is a major piece of that puzzle.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.